Hello, and welcome to the Peer Assessment Information Webinar for 2024. We wanted to confirm that you received an email where it said that you're one of 100 people selected for a peer assessment. If it said you're one of 80 people selected, then you are selected for an evidence review. In this webinar, we're talking about peer assessments. You're in the right place if that's what you were selected for. On the other hand, if it was evidence review, we have a different webinar that's better for you. My name is Dana Prucci. I'm a speech pathologist and the Director of Professional Practice and Quality Assurance. I've been in this role for almost 3 years. I'm talking to a lot of people about peer assessments, and this can definitely be quite anxiety provoking, but almost all the registrants who've been through peer assessments say it was a valuable and positive experience. And so our goal today is to give you lots of information to help you through it. With me today is Samita Joglekar.
Hi, everybody. Good afternoon. I am the advisor for audiology practice and the quality assurance program, and I've been in this role at Castle Poe for 6 years. I've spoken to many registrants about going through a peer assessment and also about mentorship, which is in some ways similar. And yeah, as Dana said, we know that this is an anxiety-provoking process for those who have been selected, but we hope the session today will be helpful. We're here to guide you through, answer questions, and many people find this process as a great learning opportunity, and we hope that you will too.
Absolutely. So as always, when we're running eForums and webinars, it might work best if you close anything else that's open on your computer at the same time. If there's a problem with the way the webinar is running for you, then back out and join in again. As Samita said, we'll have lots of opportunities for questions. Please do send them in. We'll take a time to stop in the middle and again at the end. If we don't get to your question, maybe it's we run out of time or it's something that's very specific to you, then we will get back to you afterwards. So let's look at our agenda for today. We are going to talk about preparation for the peer assessment, the peer assessment interview, and then what happens after the peer assessment. And all of the information that we're sharing is also available on the Castle Poe webpage. So if you go to castlepoe.com, hover over the word registrants, and in the middle it says peer assessment program. And this is a really great page for you to go to. There's information on the process at the top, and then lots of guides at the bottom. And specifically for you, there's the peer assessment guide for clinical peer assessments. There's the non-clinical guide for non-clinical peer assessments, and this is available in English and French. We also have the clinical reasoning tool and guide, which we'll talk about shortly, and information for employers. There's also an evidence review guide, but again, that's not for you. So we always get the question, we wanted to answer, why does Castle Poe make us do peer assessments? So this is not a Castle Poe decision, but it's legislated by the Regulated Health Professions Act. All 26 colleges do some form of peer assessments. Your chiropodist, dentist, optometrist, they all do quality assurance and peer assessments. And quality assurance is important because it measures audiologists and speech-language pathologists' knowledge and skill to ensure they're meeting Castle Poe standards of practice in the public interest. We support registrants improve practice by providing education and resources, and assist registrants to improve their skills so they can provide safe, effective, ethical care. Peer assessors all have been peer assessed themselves and know exactly what it's like to be in your shoes. They then went on to be peer assessors. Peer assessors go through annual training and take on a number of peer assessments over the year. They are warm registrants who want to get back to the profession or like meeting people, and they love hearing about what you do in your role. Peer assessors and this process are not out to get anyone. This process is not punitive. It can be a very positive learning experience, and registrants really enjoy talking about their role, their challenges, and successes. It's a conversation about you and your practice. Samita, over to you.
Thanks, Dana. All right, so we wanted to spend the first part of this presentation talking about what happens before the peer assessment. So we're going to focus on that now. And to help us go through that, let's have a look at a sample self-assessment tool, because that is what you will be working on between now and when your peer assessment interview is going to happen. So I think, Dana, you might need to share your screen.
Oh my goodness.
No problem. So here we go. So we're looking at a sample self-assessment tool. Many of you have hopefully submitted this already. If you haven't, this is a reminder to submit it by the 31st, by 11:59 p.m. on the 31st, which is this Wednesday. You submit it on the 31st, but then you will still be logging in and working on this towards the peer assessment interview. So what we're looking at here is the practice description page, which you've probably already filled out. This is important for the peer assessor because, of course, the peer assessor is going to be logging into your SAT and reviewing all of this before they meet you for the interview. So you want to make sure that this page is informative. So you're making sure you fill out all of the different sections. And as we scroll down, you can see what those are. If you supervise support personnel, the age range of patients. For audiology practice, there's different areas of practice. You can check all that apply. Same for speech language pathology practice. And then we wanted to focus on this box at the bottom of that section where it says provide additional details of your practice. This is where you can put additional things that you'd like the peer assessor to know. Maybe you see a unique group of patients. Maybe you do particular types of clinical assessments or work. Maybe you work on interesting interprofessional teams. So this is a great place to add those additional details that are not covered by other parts of this section. And then in section number 9, you'll see complete only if you've been selected for peer assessment. All of the fields are important to fill out. The email address, please make sure it's current. So please make sure it's an address that you check frequently and that you're using, because that's how you receive information from us and how the peer assessor is going to reach out to book your interview. And then it asks you, when would you prefer the peer assessment take place? We will do our best to accommodate your request. So please indicate there what time frame you want the peer assessment to happen, because we'll do our best to accommodate that. The evidence review section, again, not applicable to you. You don't have to worry about that. Okay, so let's move to now the professional standards section of the SAT, and we'll spend some time here. This is where the bulk of your work is going to happen, working towards the preparing for the peer assessment and the meeting or interview with your peer assessor. So you are working on this section, you're filling it out. Please ensure that you're working on the 2024 SAT. At the top, it should default to 2024, but make sure it's 2024. You do not want to be filling out this information in the 2023 or any other year. So you are working on this, and let's look at a standard together and talk through it. So let's focus on indicator 1.2. I maintain records in a reasonable time which accurately reflect the services provided. So for each practice standard indicator, there's guidance and there's examples. The guidance is reading and information that help you understand the standard better. The examples are ways that you can show that you meet the standard. So you're reflecting on your practice, you're giving yourself a rating on the standard. I meet the standard, I need work. And then you're uploading your evidence. And the SAT will tell you when evidence is required from the patient record. So you can see that it's noted there. The indicators that require that will have that. Some indicators don't have that, which means the evidence can come from outside the patient record. And then you've got the comments box, which you're filling out. So that's where you can provide details to explain the evidence, to give some context to the peer assessor on the evidence, to put any further detail in there that's going to help the peer assessor understand how your evidence reflects that you meet the standard and how you meet the standard in your practice. Now, the good thing is for the peer assessment, you're also going to be meeting with the peer assessor and talking about this. So maybe the comments also should be good recall for you, when you're having the interview. So a couple of points about the evidence. It must be filled out forms, right? So it has to be forms like case history forms, consent forms. Please don't upload blank forms. The peer assessors do not find that informative or helpful because it doesn't help them understand how you use those forms in your practice. So make sure you're uploading filled out forms and that you're able to discuss those or put in the comments additional information about how you're using the forms. So the other thing about that is you need to be uploading evidence from 5 patient records at minimum. And that's because the peer assessors want to see a broad picture of your practice. So different patient presentations, different types of cases. That doesn't mean that more than one piece of evidence could come from one patient file, but you don't want to have all of your evidence uploaded from just one file. It needs to be from across at least 5 files. So for the non-clinical peer assessments, if you're here in your non-clinical, you're following exactly the same process, except a lot of your evidence won't be coming from a patient record, of course, because you're non-clinical. So the indicators do look a little different in the non-clinical self-assessment tool. If you work in more than one place, you can upload evidence from both places. We also want to tell you to make sure that you have access to your evidence during the interview, the virtual interview with the peer assessor, so that you can refer to the evidence if you need to. Sometimes you might need to look at it, show further details to the peer assessor. So make sure you set things up so that on the day of your interview, you have access to all of your evidence files. And the evidence should be current. So from within the last 3 years, the more current, the better. So again, you're working on all of this, working towards that March 7th deadline. By March 7th, you must have all of your evidence uploaded, give yourself a rating on those indicators, and put in your comments. Okay, so I think we've talked a lot about this part. We do have a handout attached called Tips from Peer Assessors. These are some really good pointers from the peer assessors on uploading your evidence and sort of how they would give some guidance around that. So you can click on that and download it as a resource. So let's talk a little bit more about the evidence for the indicators. So what Dana is showing us now is the peer assessment guide. This is a great resource. Please read it. It probably has a lot of answers to the questions that you have. Of course, if it doesn't, then you can always contact us. But at the end of this guide, there is an appendix that tells you, again, which indicators require evidence from the patient record. And there's also a non-clinical peer assessment guide. Right now, we're looking at the clinical one. So one thing, an important point we wanted to make was that for each of the indicators, we want you to upload one piece of evidence, the best piece of evidence that you can find to reflect that you meet that particular practice standard. Of course, except there's some exceptions. So let's talk about those exceptions. The first one is indicator 1.3. This is for audiologists. This is, I perform and document the controlled act of prescribing a hearing aid for a hearing impaired person according to the practice standards and the position of the college. So for this indicator, audiologists must upload 8 pieces of evidence. Now that sounds like a lot, but I'll clarify what that means. So what we are asking for is that you upload a piece of evidence reflecting all 4 phases of the hearing aid prescription process. So a piece of evidence that shows the hearing aid assessment, evidence that shows the prescription for the hearing aids, evidence that shows verification, and evidence for validation. So 4 pieces of evidence from 2 different patients. So that totals 8 pieces of evidence. All right, and the second indicator that we're asking for more than 1 piece of evidence is 1.5. I am accountable for support personnel providing intervention under my direction. So this would be applicable to audiologists and speech language pathologists. And here we're asking for 2 examples of evidence showing different aspects of the supervision. So that could be documented consent to have the support personnel involved in the patient intervention. It could be co-signed patient record notes showing that you've been supervising, but you must show 2 examples of evidence showing different aspects. So other than 1.3 and 1.5, you need to upload 1 piece of evidence, okay? And we encourage you to find the best piece. The other thing is you do have the opportunity to discuss it with the peer assessor. So keep that in mind, that there is the conversation that's going to happen later on. Okay, so we wanted to talk about what this evidence could look like. So here we're looking at a fictitious page of a patient record, and let's think about indicator 4.3. I'll tell you what that is. It's I communicate respectfully and collaboratively with patients, families, caregivers, registrants of my profession, other professions, and coworkers and employees. So this is an example of evidence that could be selected from the patient record, for example, to reflect that this standard is being met. Now you can see this is an entire page from the record, and then the information in this part of the record that is applicable to the standard has been highlighted. So it says on September 9th, spoke with Darius Duck, SAMS OT, and then some further information. So that shows that this audiologist or speech language pathologist has been collaborating with other professionals and communicating respectfully. So this is to show you that you don't need to upload an entire record, okay? Because some records have tons and tons of pages. That would be very cumbersome. You need to pick the piece of evidence that has the part of the record in it that is most applicable. Okay, but you can include the whole page. So it might be 1 or 2 pages from a record, and that way the peer assessors still see some of the context, but it does not have to be an entire record. Okay, you can also use recorded or photographic evidence. So if we jump back to the SAT, let's look at 1.7, for example. This is I follow health and safety procedures and practices. So you'll notice that above the evidence box, it doesn't say upload from patient record. And if you look at the examples, some things could be a picture that shows evidence that you're sterilizing equipment. It could be a picture to show that you're disposing of single-use items, or during the interview with the peer assessor, you could even take them over to that part of your clinic where you do those things and actually show them. But use the comment box and, upload something as well. So we wanted to talk about, you can be creative with your evidence. Photographs, recorded videos, you can take evidence from different sources. But be creative with the evidence and use the comments to explain. So I think, Dana, I was going to pass it over to you at this point to go through the ins and outs of uploading.
Absolutely. Thank you so much, Samita. So I'm not going to show you how to take screenshots. It's all in the guide because computers are different, or you can talk to a techie person that you might know. But we recommend saving the evidence on a folder on your desktop or on your computer, because that way you can add it and then upload, and you can also rename things before saving it. So one of the things that peer assessors and registrants, and we find really helpful, is if you name things by what the evidence is for. So 1.1, for example, and to make sure you've got all 5 patient records, you can call them PR1 for patient record 1, 2, 3, 4, 5. If you've already uploaded and you use patient names instead of renaming it to patient record 1, that's absolutely fine. You don't need to go back and change everything. In the name, make sure you use numbers and letters and no special characters like quotation marks, because that seems to be a problem on uploading. So if I have my folder here and I say, oh, okay, well, I still have this patient's name in here for 1.3. So this is patient record 1, and I'm going to write this as evidence for 1.3, hearing aid validation, just like Samita was talking about before. So now I have that set and I'm ready to upload. We also wanted to mention that there's no need to redact any personal health information. The Regulated Health Professions Act supersedes PHIPAA. However, if you want to, you can. We frequently hear from hospitals that they have concerns about uploading personal health information, and if you or your employers do have concerns, have them call us. There's no harm in sharing with the privacy officer or your employer about needing access to files. Again, all regulated health professions have peer assessments, so hospitals and larger organizations will be very familiar with this. As well, no patient consent is needed. You don't need to tell patients that you're uploading things. There's a letter to employers that is on the website that I showed you. The self-assessment tool is extremely secure. There's no need to redact information. We have an IT jargon letter that we can share with you to share with your employer or the privacy officers that really goes into detail on the IT. Neither of us understand what it is, which I think is actually a very good thing. So you can send yourself the evidence, and once you upload the file, especially to your computer, securely delete the evidence from however you sent it, from your phone, for instance. If you don't know how to do this, get some IT support on it. And when you're taking screenshots of evidence, be sure not to upload them upside down. We want to make things as easy for the peer assessors as we can, so be sure to check the evidence before you upload it. And as Samita said, be sure to use the comment box. A brief description of why you chose that evidence can be a lot of information that will be helpful to the peer assessor. So let's do one together now. So I have some evidence I'm ready to upload for 4.2. I communicate in a manner that is responsive to the diverse background, identity, and experiences of the patient, families, caregivers, and other professionals. So I'm ready. It doesn't have to be from a patient file. As Smita was saying, it's not in here, so I will click on upload your evidence, and a box pops up, and you can choose the file. So the folder will come up. This is for 4.2. Here we go. You can see it. It comes up in a little box, upload files, and here it is. I'm going to write a little note in here just so I remember and so my peer assessor gets it. This is a handout I made for a 6-year-old child and their family who speak Urdu. Visuals and pictures with words in both English and Urdu, or whatever it is, the information that you want to say. Once you've uploaded any evidence and use the comment box, be sure to hit save. I'm sure the question has probably already been asked. I've already submitted my SAT, or I'm going to submit it by January 31st. Can I still access it afterwards? You absolutely can. You have till March 7th to upload evidence. So by saving, it automatically is saved to the SAT. You don't need to resubmit. Now, let's say you have new evidence. So you've uploaded this great evidence for 4.2 today, and oh dear, it actually is the wrong evidence, or you find something better before March 7th. Then you can add and remove the first. So I see a question's actually come in on this, but I can answer right now. There's a little red stop sign beside the evidence. So if you click on that X, you'll be asked, are you sure you want to delete the file? Yep, I do. And so then you can delete the comments or write something in as well. Okay, so I am going to intentionally stop sharing my screen now. And I think we can take some questions if there's anything that's come in. I might have been answering them as we go already as well.
It's possible. I see a question here. I'm just going to read it. For 1.1 criteria to begin and end intervention, is that really from patient records? It seems like this is the criteria that my agency has, which is not really reflected in reports. So I can share some thoughts on that, and Dana, tell me if you have any additional. You do have to have, I mean, so the agency criteria is part of that, right? So there needs to be some idea of when do you know you need to start patient intervention, and how do you know when it's over, right? What are the criteria for initiating service, and what are the criteria for discharging a patient? You need to have that. You need to show that you know that what that is. For different areas of practice, different patient populations, it might be different. So agency criteria is something that you could potentially use in your evidence to reflect that you understand that standard. Dana, anything to add?
No, I think that's true. Again, we're looking at you as the registrant, as the professional, to figure out what best represents it. You're having a conversation with the peer assessor, and you can use the comment box. There's another one, I accidentally submitted my SAT, then realized I made a mistake. You can always access your SAT during the year, just hit save. So if you change your mind on evidence, or you said that something is applicable and then you realize, no, actually that's not an applicable indicator, that's something that you can change. If you want to change your practice description, absolutely go for it.
There's a question, can we upload any type of evidence file, such as Word, document, PDF, etc.? So the types of files that are accepted by the SAT are in the guide, but all of those that you've mentioned are acceptable file formats. So yes, you can do that.
There's a question here about, I work in 2 places, so do I have to have evidence for both? It's a great idea too, and you don't have to. I think some people have asked in the past, I work mostly at this place, should, if I'm there 90% of the time, should 90% of my evidence be from that one location? You can figure out what, again, represents you. You should be demonstrating the same professional behavior and the same clinical, if you're clinical or non-clinical behavior, across all workplaces. So it's a great idea to have evidence from both.
That's good.
Maybe let's take one more question and then we'll.
Yeah. You mentioned that we can choose to share evidence from more than, oh, the question just disappeared. Oh, we can choose to share evidence from more than one practice location if we work in more than one practice location. Is it required to share evidence from each location? No, you don't have to. You can upload from more than one location if that is reflecting best how you meet the standard.
Okay, I think we've got lots of questions. We're very excited to get to them, but let's get through the rest before we, and then we'll take time at the end for them. Okay, so one of the things that's important before the peer assessment, and also that will be discussed at the peer assessment, I'm going to share my screen at the same time, there we go, is having 2 documents to discuss with the peer assessor. So one of them must be the required reading from this year, which is Castle Post Standard on Use of Restricted Titles. And then you select another document you want to discuss. You should let your peer assessor know ahead of time and choose something that's relevant to your practice. And so to mention, in the past, you actually had to upload evidence for 5.1, which is looking at reviewing in detail specific Castle documents, but we decided to make that optional. If you have something you want to upload, great. If you don't, that's okay too. Also wanted to mention that for all of the documents that we have at the bottom of the page, it's really important that you are aware of all of them, especially those that are relevant to your practice or know where to find them. You do not need to read all of the documents every year, but for instance, guide for obtaining consent. That's probably very important for your practice. That's something you need to know about, be familiar with, and probably know where to find as well. Peer assessors are going to look at changes. They're going to look at your learning goals and CLACs. So for 2023, you should have at least 15 continuous learning activity credits. It's great to upload some evidence for them. And then they'll also look at your new learning goals. So we have one in here already for a webinar that we had earlier in January. If that's something you attended, great. If there's things that you've done before you meet with your peer assessor, you might as well enter the CLACs in so that you and the peer assessor can talk about what types of goals do you have? Are they SMART goals? How is the learning going? And we always recommend to fill in the progress to meeting the goal, whether it's none, minimal, moderate, or significant, and the impact on the practice. And again, you can choose to upload evidence or not, that's up to you. For the ratings on progress and impact, there's no right answer, it's your learning. It could be something new or validating what you already know. And again, enter anything that you have for 2024 already. All right, Samita, back over to you.
Okay, thanks. So what we've covered so far is everything that's happening that you're preparing for before the peer assessment. And there's one more thing to mention that's happening behind the scenes. So while you're working towards this March 7th deadline and putting all of that great evidence into your SAT and your comments, we are training the peer assessors here at Castle Poe. So the peer assessors receive annual training. We have new peer assessors every year who get extra training. And then we're matching you. So there's matching the registrants and the peer assessors. So again, that's where we're using that practice description page in the SAT to match you with a peer assessor according to profession, areas of practice, and also language. So if you speak French, we put you with a peer assessor who also speaks French. With non-clinical peer assessments, we match you with a peer assessor who does non-clinical work and peer assessments. So you will get an email with the peer assessor's name sometime in March and a link to them on the public register so that you can see who they are. You can veto the peer assessor who is assigned to you one time. That will remain confidential. Staff will know, only staff will know that that's happened. And then we match you with a different peer assessor. And then that is the peer assessor that you will be working with. So you get one veto. All right, so we've now covered everything that happens before the peer assessment. So now let's talk about the actual peer assessment during what happens. And that is the virtual interview. So basically for the virtual interview, your peer assessor is going to reach out to you to book the date for the virtual interview. And once you've decided on a date, the peer assessors will let us know when that's going to be taking place. If there's a change in the date booked for your virtual interview, the peer assessors will also keep us notified on that. Try not to change the date too much with your peer assessor. Of course, you are a practicing audiologist or SLP. We understand everybody is very busy. The peer assessors are also practicing colleagues, and they're very busy. They also know what it feels like to be you in this case, because as Dana mentioned, they've been through all of this. So they're going to try to not change the date of the interview on you, at all. But if you do need to change it, let us know, or the peer assessors will let us know. Make sure that you have at least half a day reserved for the virtual interview. Usually these interviews take about 2.5 to 3.5 hours. The non-clinical peer assessments are a bit shorter because you don't do the clinical reasoning tool discussion. But a half day for everybody is probably best because then you can go at it with a more relaxed, you won't run out of time. So we recommend a half a day. We leave it up to you to decide on a mutually convenient virtual platform for this. So you can decide that with your peer assessor. All right, so let's look at the components of the virtual interview. So this is what's going to be happening during the virtual interview. This is where you get to have a conversation about your practice. So you get to tell the peer assessor about your practice, what you do. You'll be going through the indicators in the SAT and looking at those. Your peer assessor will have some questions for you. This is why we were saying it's good to have the records available that you submitted evidence from, because you can look at those. You don't have to, they don't have to be kept aside. You open up the records if you need to check anything. Sometimes that chart simulated recall is very helpful. So make sure you have your evidence and the files available. One thing that could happen is the peer assessor may actually reach out to you before the virtual interview because they're going to go in and look at your SAT first and review everything. Now, before the interview, they may actually reach out to you and say, hey, could you please upload another piece of evidence for indicator, I don't know, 1.5? If this happens, don't be alarmed. It's not anything irregular. It's completely normal for that to happen. All right, so then what will happen during the interview is as the peer assessor is having a discussion with you about the indicators, they will be asking some behavior-based questions. This is part of how peer assessors are trained. And these behavior-based questions are related to standards that are higher risk of harm. So for clinical peer assessments, there are 6 to 8 standard indicators. And for non-clinical, there are 4 standard indicators. There is information in the guides in the appendix that tell you which indicators have a behavior-based question. And the peer assessors will always ask these questions. They're trained to do so, irrespective of your evidence. And basically the questions are used to determine how you behave as a speech language pathologist or audiologist in given situations. This is not difficult, it's nothing to worry about. You just need to be able to talk about what you do. Okay, and again, this is a collaborative and supportive discussion with the peer assessors. They're not looking for mistakes. This is not a punitive process. Okay, so then, as Dana mentioned, the peer assessor is going to review your learning goals. So they're going to look at 2023 learning goals and your CLACs. And then they're going to look at which goals you've set for 2024. They might ask you a little bit about how are those goals going this year? Is there anything new you'd like to learn? You know, they might just ask you to talk about your goals a little bit. Okay, then as Dana mentioned, you're going to discuss 2 CASLPO documents. There's one that's required, which is the standard on use of restricted titles, and then you pick the second CASLPO document. And then there will be 2 clinical reasoning tool discussions that happen in the virtual interview. So let's spend a little bit of time talking about the clinical reasoning tool. So the clinical reasoning tool was introduced into peer assessments in 2019, and it was actually based on feedback from SLPs and audiologists who had gone through a peer assessment, and they gave the college the feedback that the peer assessment was fine, but they didn't get a chance to really talk about what they do when they see a patient, like how they actually practice. So this was in response to that. It was to have this clinical reasoning tool discussion to illuminate, like to allow the professional to talk about why they did what they did with a particular patient. There was a lot of research that went into developing the tool. There's a lot of research that says that clinical reasoning is, very important for all health professions, and that it's a very good way of demonstrating competency, but also for seeing gaps and for improving. So the clinical reasoning tool and the guide Dana showed us at the beginning, they are on the website. You can look at the tool, you can look at the guide, you can have an idea of what that's going to be before you meet for the interview. And there's also several CASLPO webinars on the clinical reasoning tool. If you go to the e-forums section on the website, you'll find one in 2019. There are also mentorship web training webinars on the clinical reasoning tool if you're interested. So how will you get ready for these clinical reasoning tool discussions? Well, have a look at the tool, but then the other thing you need to do is you need to have 5 patient records with different presentations ready, 5 different patient presentations. These could be the same 5 records that you've used to pull your evidence from that you're uploading into the SAT. You will pick one of those files to have the clinical reasoning tool discussion, and then the peer assessor gets to choose the second one. So you would tell the peer assessor, I have a vestibular intervention patient, if it's an audiologist. I have a tinnitus patient. I have a hearing aid patient. Speech language pathologist. I have a speech language. I have apraxia of speech, swallowing. You have 5 different patient presentations. You let the peer assessor know, and they get to pick one. So you want to make sure that these 5 files represent patients who you can talk about, those cases well, and you can have a informative discussion about them with the tool. The peer assessor is going to record these discussions. They're trained to do that, and that's so that the peer assessor can listen back and determine the clinical reasoning. Of course, there's an indicator in the SAT 3.7 that the peer assessor is determining, is that standard being met? Okay. I think that we're ready to answer more questions if there are any.
Okay, so I see questions here we always have on the clinical reasoning tool. Do they have to be the same 5 patients? No, you can have overlap. Sometimes people, I think usually people don't pick exactly the same 5 patient records, but there might be an overlap. It's again, something that you can do, something that you feel that you would feel comfortable talking. And of course, the clinical reasoning tool is just for the clinical peer assessments. If you're non-clinical, then you're not going to have the clinical reasoning tool.
Yes. There is another one about clinical reasoning tool. Do you actually want to see a completed clinical reasoning tool and evidence from the patient record? So you do need to upload evidence to show that you meet the standard before the virtual interview happens.
For 3.7 for the clinical reasoning.
For 3.7, yeah. You do need to do that by March 7th. we're not necessarily asking you to upload a completed clinical reasoning tool. No, it doesn't have to be that. It should be something else that you can upload to show your clinical reasoning. And then the good thing is you get to talk about it and discuss it with the peer assessor in addition to having these clinical reasoning tool discussions. But we're not looking for a completed tool as your evidence.
I agree. I think in fact, you don't need to do the clinical reasoning tools for that, since you're going to be doing it with the peer assessor for 2 others. But what's something in the record that shows you use clinical reasoning? If, clinical reasoning might be something of, I didn't do a formal assessment on this patient because blah, blah, blah. That's a great way that you can demonstrate clinical reasoning, but I'm sure that you can come up with other great things as well. Okay, let's continue on, and we'll have more time for questions at the end. And again, I'm going to remember to share my screen this time. There we go.
Okay. So I think I'm still talking about this part. So we're moving on to, we're still in the part of the presentation where we're talking about what happens during the peer assessment. Okay. So this is something that could happen, virtual remediation. This could happen if the peer assessor, through the course of discussing your evidence and the indicators, the peer assessor might find, oh, we need some work to meet one of these standards. You might realize that yourself as you're having the discussion. The peer assessor might realize it. You might realize it together. If that happens, the peer assessor will provide some virtual remediation, which means they'll give you some guidance right there in the moment if it's realized you need work. And then you, together with the peer assessor, will generate a solution, right? So you'll come up with the solution together. If we click through to the next point on the slide, the peer assessor will give you a short time frame in which to do some additional learning, upload some additional evidence, whatever the plan is that you come up with together, you'll be given some time to do that. It could be anywhere from a few days to weeks, 4 weeks, okay? And then the peer assessor will ask you to, in addition to uploading new evidence, they'll ask you to do a nice short-term learning goal. So maybe it's, I'm gonna read this Castle Post standard and to put that in your CLACS. So a learning goal in a CLACS related to remediating and making sure that you meet that standard. So the peer assessors might do this for 1 or 2 indicators. And again, the reason why the peer assessors have been trained to do this is because a lot of evidence shows that in the moment education and remediation is the most effective catalyst for change in knowledge, behavior, and activities. So it's really effective when you learn in the moment and you also get to direct your own learning. We just want to stress, again, this is a collaborative and educational process, right? So the peer assessors are trying to guide you through this. They're not trying to, look for anything that's wrong. And the peer assessors might give you this in the moment remediation for minor patient risk, 1 or 2 professional indicators or standards that need work. There are some standards that are significant patient risk where the peer assessor can't provide that in the moment remediation. Those actually need to go to the Quality Assurance Committee. So to give you an example of one of those, the standard on patient confidentiality. If the peer assessor, if it comes out in the discussion that there's been some confidentiality breach or a privacy breach of some kind, that's not something that the peer assessor can remediate there in the moment and give guidance. It would need to go to the Quality Assurance Committee. Okay, so the peer assessors will email you a plan for the remediation if that happens, and then they will also CC Dana on that plan. So Dana will know which people who have gone through peer assessment have some type of virtual remediation that's going on that they're working on. So we wanted to just show you some of these indicators. I think Dana, I was going to pass it over to you to cover these.
Great, thank you so much. So these are common indicators that do need remediation. Maintaining records, 1.2, 1.5, I'm accountable for support personnel, 1.10, I maintain financial records, patient financial records. 2.4, I use intervention procedures responsive to the diverse background, identity, and experiences of patients and or substitute decision makers. 2.6 is having a professional network. 3.1 and 3.2 are all about consent, and 4.5 is advertising. So an example for not documenting consent would be the peer assessor and registrant have a conversation on how to fix the problem. Maybe it's adding a line to the assessment forms, add a learning goal, and then let me know. At the end of the peer assessment, the peer assessor will not tell you if you were successful. That's determined by the Quality Assurance Committee. You should know how you are doing based on the conversation and if there's any remediation. So after the peer assessment, the peer assessor will write a summary or a report within 10 working days. And they sound very similar, but they mean something very different. A summary is very short, and it means that you have met or exceeded all expectations. The summary does not reflect all your work. If there's any remediation for 1 or 2 standards, once they're completed to the peer assessor's satisfaction, then you'll get a summary. A report, on the other hand, shows when indicators still need work. So maybe there are many indicators, and so if it's more than 2, you can't have virtual remediation, or it's a high-risk indicator requiring more than virtual remediation, or there was remediation and it was unsuccessful. And so the Quality Assurance Committee will direct you on how to proceed. You're sent a copy of the summary or the report, and you have a week to respond and send us an email if you have any comments you want for the committee. The report, the summary, and any information you send are anonymized. So the Quality Assurance Committee, when it meets, will only get your peer assessment number. The Quality Assurance Committee will decide if they need more evidence or if you have the required knowledge, skill, and judgment. This committee meets about every 6 to 8 weeks, starting in April, so you might have a bit of time in which to wait. And you will receive an email letting you know their final decision, hopefully congratulating you for completing the process. Once you've completed this process, you are out of the pool for peer assessments and evidence reviews for 10 years, so you cannot be selected during that time, which is good news. You're putting in lots of work now, but it does mean that you're out of the pool for 10 years. After you get the email, you can also delete the evidence that you've uploaded if you like, and you'll get a survey from the Quality Assurance team. I'm sure that you feel like you're filling in these surveys all the time, but the feedback has been invaluable and helps to inform future peer assessments. How could the process be better if we don't hear from you? And as Samita said, that's where the behavior-based questions came from. Audiologists and speech language pathologists felt that they needed some sort of follow-up like that. All right, we have actually some feedback from the survey. There was lots of great feedback we had, but we wanted to share with some of you some of the things that we heard. Again, these are people that were probably feeling the way you are right now, wishing that they were not selected and not excited about having to go through peer assessment. But it was, if you look at the words, very positive experience, warm, welcoming, professional for the peer assessor, and it was all in all a good learning experience. We appreciate all the resources and support offered. I found the entire process very helpful and learned, I think, to be a better clinician. And so it is lovely to know, and we can share this with you as well, if you want to see how people do feel afterwards about having the peer assessment. 6 new peer assessors are with us this year. They all had their peer assessments last year. They successfully completed their peer assessment, and in addition to the 10 years, if you're a peer assessor, you will not be chosen for peer assessment because there's lots of training involved in this process, and they are very much on top of all of the CASLPO standards and other guides. There's information in previous Express newsletters about becoming a peer assessor or survey feedback from having peer assessments. Okay, I'm going to stop sharing, and I think we can take the last chunk of time for more questions. Again, I see there's lots of questions in here, so if we don't get to yours, we'll get back to you afterwards.
Yes, that sounds good. There's an interesting question about quality of evidence. In terms of quality of evidence, recognizing that this is a time-consuming process, are the assessors judging some evidence as better than others? I feel like you could spend a lot of time deciding what evidence would be better than others. So, I mean, we really are encouraging you to, in your professional judgment, choose the best piece of evidence that reflects how you meet a particular standard in your practice. I wouldn't say that the peer assessors are not, judging some evidence as better than others. They are looking for the minimum that you show the minimum that you meet that standard. The standards are a minimum requirement, right? We all have to meet those standards at minimum. So they are really looking for, are you showing that you meet that standard given how you practice in the profession? I hope that helps a little bit.
The question, it's funny, I always feel like, oh, we planted these questions. We get these questions all the time. They're great. There's one for the clinical reasoning tool, which is again for clinical peer assessments only. I see primarily one type of patient. So maybe you're someone in speech pathology that only does motor speech or that only does swallowing. In audiology, you only deal with cochlear implants. However, I would say that there's differences between all of those patients. For motor speech, is there a language delay that goes along with it? Is there some sort of diagnosis that the patient has? Maybe the patient and their people speak a different language, and then you have that to add on as well. Again, coming from a pediatric background, if it's a child, maybe the parents are divorced, and so that adds another layer of complexity.
Yeah, I totally agree. Like no two patients, even within the same practice area, are the same. And really, the clinical reasoning tool is you're telling the story of that patient. So with every patient, maybe you had to ask different questions. Maybe you needed to use different assessment tools. Maybe the goals of the treatment were different. The age of the patient. I mean, there's so many different things. So even if you're really concentrated in one practice area, your patients will be different from each other, just as Dana said. I think there's a couple of kind of quick ones. For standard 1.8, I have not had to make any mandatory reports. What can I use for evidence? So it's true, you may not have ever had to make a mandatory report, but you still do need to understand the standard. So you need to, in that case, show how you understand that standard. And you can use your professional judgment to decide what would be the best way of reflecting that. Dana, maybe you could help with this one. How do we manage when we are relatively new to an organization?
Sure, absolutely. So evidence again can be from the last 3 years. So maybe you still have access to files or to policy from previous positions. And if you are new to an organization and I don't know, maybe you haven't been working for the last 3 years, so it's really, it's new stuff, reach out to us and we'll figure out a plan. It's not a great answer, but there you go.
Uploading evidence is only through the SAT, or can we upload to the assessor via Google Drive? No, you must upload your evidence through the self-assessment tool. Do not use any other type of tool or program to do that. As Dana said, the SAT is secure, and because you're uploading evidence from patient records, it has sensitive personal health information. So please do not use anything but the SAT to upload your evidence.
I think that's true. There's a question about how does our peer assessor choose a file? Do we email them a link? Do we have to upload the whole file? Is the other part that we often get. Do we have to upload the whole file for clinical reasoning? No, you can just give a description. Okay, I have a patient who has a diagnosis of autism, and this is about how I was the first professional to see them. This patient, again, I'm going to speak from my pediatric background. This patient has childhood apraxia of speech. This patient has a traumatic brain injury, and this one has blah, 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 blah. And so the peer assessor will say, oh, you know what, I want to hear a little bit more about the patient with traumatic brain injury. That's how they make the decision. And then you would pick one of the other four on your own. And when, I think Samita mentioned before also, this is why you might want to have access to the files there, because you're not going to be memorizing 5 entire files. And so if they have a question for you, it's something that you can actually, I always feel like this, so I'm holding a file that you have access to digitally or in front of you in paper in order to get to it.
Yeah. There's a question from someone about working in an area where the colleagues are around in the same room. So not being able to show the peer assessor things live because there's lots of people in the room. Yeah, you can absolutely take pictures of things And I mean, one of the good things about this is you do get to have that conversation with the peer assessor and explain. So you can take photos and then you'll have the opportunity to explain how you do things with the peer assessor. So that's perfectly fine. How many? Oh, go ahead, Dana.
There's a question. Some of the evidence, like videos, I can't upload to the SAT. So a few notes on the SAT. First of all, it's a digital system. And so if there are any files that are too big, then it will have a hard time uploading. I think if you have a really, really long video, it might not upload, although I think it's pretty good about that. The other thing is that sometimes you just need to be patient. So if you upload something, you saw I uploaded a one-page document when I did it before, and it uploaded shockingly instantly. But if you have something like photos or videos, that can take longer to upload. So I would just say be patient, see what happens. If there really are struggles, absolutely let us know, and we can get in touch with the SAT company to make sure that everything is going the way it should. They're the ones that told me, I think last year, when someone couldn't upload one of a piece of evidence, and they said, oh, that's because there's dollar signs and quotation marks. So that was great information for us that we wouldn't have known about had the registrant not reached out.
Yeah, I think if it's a video that's like high definition and really big, it might be too big for the SAT, but you could play that during your peer assessment interview. That's the other option. You know, describe it in the comment box and then show the peer assessor when you have the interview with them.
We have a question on time spent preparing for the peer assessment, and if any of that can be used as continuous learning activity credits for 2024. It's a great question, and we would go back to the point of continuous learning activity credits. You need to have a learning goal for it. So if you have a learning goal about quality assurance with the college or about consent, and that's what your learning is towards, then you can count it. But just like mentorship or supervising students, or you can't count all of the hours in it unless you have specific learning goals and you're actually learning at every moment that you're uploading the evidence.
With respect to how long does it take, I'm not sure we could give like a specific answer on that. It will take some time because you have to think about the standards and you have to upload your evidence. I don't think there's a standard amount of time that it takes for everyone. It varies.
I will say, however, one piece of evidence for each of the indicators, aside from the two that Samita talked about, take way less time than uploading lots and lots of evidence. And again, like, we get how audiologists and speech pathologists work because that's us. And I always think about 1.2, I maintain records, that it's very hard to choose what's the record that you want to show to demonstrate that you're meeting the standard. Maybe it's a report that you wrote. Maybe it's a session note that you wrote the day of the session. Maybe it's a session note that you entered a couple days later and it says late entry. Don't upload 3 of them. Upload 1. It will make it far easier on you and far easier on your peer assessor. Okay, I'm going to start sharing my screen again. If we didn't get to your question, or if you have more questions that you thought about afterwards, just send us an email. So we wanted to remind everybody that we have these resources on the Castle Poe Peer Assessment website. The French and English peer assessment guide for clinical peer assessments, the non-clinical peer assessment guide. We have the clinical reasoning tool available as well as the guide, so there should be no surprises. There's the information for employers. These are all things that you can have access to. You do not get the behavior-based questions ahead of time, but Samita did show in the guide how those are available to see which ones will have behavior-based questions for clinical and for non-clinical. And we also just wanted to point out that you should be using your best professional judgment for what to upload. I feel like every year we get emails saying, can I upload this? Is this good? Is that good? What do you think as an audiologist or speech pathologist is the right evidence to upload? And you can talk to your colleagues. You can talk to other people who have been through this or who haven't been through it, just to get this feedback. So we wanted to also point out that the college is protecting the public. It's not that the college thinks that you're bad at your jobs. In fact, we know most of you are amazing. This is the way that we can show it to and protect the public. So we have on this last slide our email addresses. If you have questions, if you have concerns, if you want to know the status of your peer assessment, absolutely send an email. You can email qualityassurance@castlepo.com. You can email Samita at sjablikar@castlepo.com or me at dprucci@castlepo.com. So hopefully this was something that was very helpful to everybody. We got in an hour. Thank you so much for attending. Wishing you all the best.
All the best. Thank you.